Morning, everybody. Welcome to the Mayor's Monday Message for May 11th, 2020. I wanted to start off by acknowledging the pioneering work of Detective Billy Smallwood, one of our early African-American detectives in the York City Police Department. Started in 1963 and served for 30 years with the City of York. So my condolences to his family, but I hope everyone will remember Detective Smallwood and remember our heroes, both in the past and of today. Wanted to remind folks, if you haven't been keeping track, we did extend the property tax 2% discount period for a month from April 15th to May 15th. May 15th is coming up Friday, so if you wish to see your 2% discount on your taxes, they do have to be in by this Friday. Don't worry about, if you don't want the 2% discount, we've got plenty of time. There are no penalties. We'll just be moving into the regular phase of the tax rates. So again, May 15th, this Friday, the 2% discount period does end. We opened up last week and we've already gotten 80 people starting on the applications, about 24 applications completed so far for our micro business grant program. So businesses with 5 employees or less that are owned by residents of the City of York, and the businesses are in the City of York, can get up to $5,000 grant money for their business needs. And so we just got to get online. We'll put the link on there and make sure that everybody that is a city resident and has a business in the city with 5 employees or less applies to us, and that money will be we'll be looking at those applications. We're taking applications for 2 weeks. It started, I think we're taking applications until May 18th. So you still have another week to get the application in, but there is some paperwork in there. I apologize for the length of the application. It's not very long, but you are required to have a copy of your lease and some other financials in there. That is not a requirement from the City of York. Unfortunately, we had to follow the federal guidelines for giving out this money, which when we started, our application was about 6 questions. So now once we're giving out federal government money, it got a lot more involved. So I apologize for that. The Spanish version is also online. We'll send the link to that and make sure that everybody has an opportunity to get the grant. I did want to remind folks, I started this last week, but some individuals who are hearing impaired and advocates for the hearing impaired have contacted me and said, could you please pull your mask down at least during your messages so those that read lips can get more information. Now, we will be adding a transcript of the Monday message after we're done here, but doing this just for those that requested, those that are hearing impaired. So don't need to see any messages about, oh, he's not wearing his mask. My mask's right here, just pulling it down temporarily to help those that also need to get the information. Speaking of masks and COVID and what's on everybody's mind, obviously this week there has been a lot of controversy around what York County and York City are going to do regarding the reopening of businesses. I want to start by saying that when I became mayor, I made a pledge, I swore an oath to obey and defend the Constitution of the Commonwealth of Pennsylvania. And within that Constitution, and then the powers that are derived from that Constitution through the governor's office, the governor is allowed to create emergency orders. Those orders are to be followed as law. So no confusion, don't need to comment on it. These are the facts. These are the facts right here. The governor shall have the power to modify the provisions or the Commonwealth to be effective at any or all hours of the day or night. Such modification, no person, unless specifically exempted by the terms of the declaration of emergency or by other provisions of the statute or other laws, shall violate any of the terms, conditions, provisions, and modifications set forth by the governor. and any person violating may be subject to summary offenses and upon conviction sentenced to pay fines. So I understand that people think that I can take an action and have an opinion on whether businesses should open or not immediately. I do have opinions. They have nothing to do with the enforcement of orders that were handed down by the governor. So the city of York will continue to enforce, to the best of our ability, all of the orders of the governor and his secretaries. I want that to be very clear. The statement from the district attorney regarding criminal charges has nothing to do with our ability to enforce administrative and civil codes against those that choose to violate these orders. We have yet in the 6 weeks, remember this has only been going on for 6 weeks. I know some people feel it's a lifetime, and to some it is for some business owners. I do understand that, and for those that haven't received their unemployment yet. But in the 6 weeks that this has been going on, we have not used any criminal charges. I know I've talked about criminal charges because they are an option, but we have not used any criminal charges. So the district attorney's statement really is moot when it comes to the city of York. We will continue to use our powers to keep those businesses closed that are required to be closed at this time, and to stop gatherings of more than 10 people, and also to keep our park equipment closed. And we hope that folks not only understand but respect this. It's very difficult to prove a negative. It's impossible for us to say we saved 140 lives by our actions, even though here in York we've only had 13 deaths, and in Lancaster they've had over 150. In Berks County they're closer to 200 now. But I certainly believe that our actions and taking this seriously from a very early time have helped to contain the virus within York County and within York City. So I would ask that everyone please voluntarily continue to be compliant with all of the orders, and we will continue to advocate for the reopening of businesses here in the city. And I want to discuss that, and in the county. I want to discuss that for a minute. I do have a guest with me, and that is Dr. Howie. So I want to actually defer to him for a second to talk about the scientific basis of these orders. There are those out there who are claiming, including elected officials, who are claiming that these orders have no scientific basis. Well, since January, I have been following coronavirus, COVID-19, and I'm also following what Johns Hopkins is saying, what Stanford University, Georgetown, all these medical institutions that we trust with our lives. I mean, when there's a problem here in York, and it's a really serious problem, and WellSpan or UPMC says, hey, this is a lot for us, guess who we trust? We trust Johns Hopkins University. And it's Johns Hopkins Medical School that is helping to provide the input for the governor's plans to reopen. So we are now on day 11 of meeting the goal of staying under 50 cases per 100,000 average for a 14-day period. We're in day 11 of keeping that down under 50. I know this can be a little confusing, but it's not just a 14-day average. It's keeping the 14-day average down below 50 for 14 days. We're in day 11. On Thursday, if we continue the trend that we're on, I have already asked the governor to reopen York County. So that would be on Friday. I am asking the governor's office. I've done this privately. All of our metrics, I believe, are in line for reopening. But that doesn't mean that we take it upon ourselves to go out and break the law. I am following the proper channels to make sure that when we meet our goals, we can reopen. So there's a big difference between how I'm approaching this and how some others in this county are approaching it. I am in favor of following the reopening plan. And if our metrics continue to be solid the way they have been for the last 11 days, reopening this Friday. So I want that to be very clear. And I just wanted to bring in Dr. Howie. Dr. Howie is not only a medical doctor for WellSpan, but he's our director of medicine here at the City of York, and also is working with York County to try and bring some of the techniques that we have done really well at here in York City, bring them out to the county so that we are all prepared for this reopening. So I'm going to put my mask back on now and let Dr. Howie address the group and share a little bit about what he's been doing for months now to keep us safe. Dr. Howie?
Sure. All right, I'm going to do the same thing that Mayor Helfrich did in terms of removing the mask, but never far away from me for sure. The work that's happened over the past few months, as Mayor Helfrich outlined, has been critical to our ability to respond effectively to COVID-19. Obviously, our jurisdiction when it comes to the York City Bureau of Health is within the geopolitical boundaries that we have. But within there, we've been doing contact investigation and case investigation and contact tracing ever since the beginning of the cases that we've had. This has been a critical element of our work, and despite seeing numbers higher than we would like, we're reasonably satisfied that our approach has been effective at limiting and reducing the number of cases in the city, and by extension, actually reducing cases in the county as well. However, opening of counties is a decision that's made by the governor, and obviously it's outside of our jurisdiction when it comes to what is done at the county level. Now, we've been working with the commissioners and other elected officials and other line leaders within the county to prepare for these coming days of opening of the county, moving from red to yellow, whenever that does occur. The numbers, in terms of the averages we've talked about, are working very, very well, are going very well. The challenge is going to be to keep them there and to keep your metrics good and limit the amount of spread of COVID-19. The social distancing is critical. When I speak to folks in the city to help them understand this, I say the toolbox has a limited number of tools, but the tools that are there work very, very well if you do them correctly. So social distancing, hand washing, covering of the mouth, limiting large social gatherings. Those are the tools that have worked around the world, and when applied well, those are the tools that have worked well in our country. And we need to remember that and respect that as we go forward. We need aggressive testing when need be. We've done a good job with testing. Our positivity rates have come down to kind of a moderate range or a medium range, which is very reassuring to us. But if you want to keep them there, you have to have some other aspects of the work. So testing is important, but then aggressive case investigation and contact tracing needs to be put in place. We've had that, as we said earlier, in the city, but to be able to get that same sort of mechanism more broadly expanded into the county is what it's going to take for us to maintain these levels and even improve these levels and reduce transmission rates. I think there's more work to be done there. The commissioners completely are in agreement with this, and we're working on that plan together with the county as well as the York County Economic Alliance, because this is a medical and public health crisis, but absolutely has significant business and economic impacts, and we're respectful of that as well. So I believe that we're meeting those metrics through good work in public health, and the expansion of that good work should hopefully help us maintain the status of a county that's doing well and has a good finger on the pulse of what's occurring with COVID-19 in our community. All right.
Thank you, Dr. Howie. You brought up a very important part about the social distancing. And I had some folks who were claiming that we were so far technologically advanced and our hygiene is so much more advanced than the Spanish flu of 1918, when in fact, in my opinion, and I think you'll agree, when you have a virus where there is no known treatment and no known cure, no known vaccine, the techniques to try and stop the virus haven't really changed in 100 years.
Correct.
We are still doing, it doesn't matter what our technology, well, now we're working on it. I know people all over the place are working on it, and but the actual techniques that we are using to stop this virus are very analog. They're very much the same things as they were 100 years ago, since Typhoid Mary, right? You find out who the contacts are, who the people are that have it. You find out their contacts. You try to limit their intermingling with the rest of the population. And the rest of the population, because this is such a bizarre virus where people can spread it before they have symptoms. Again, I can't repeat this enough. Not one of us knows whether we have it or not. We don't know. So it is imperative that we treat ourselves as if we had the disease. We do our best to stay away from others. We put our masks on not to protect ourselves, but to protect others, because we don't know what's coming out of us. When you go and hug your grandmother, you don't know if you're sick or not. When you go to gatherings, you don't know if you're sick or not. So this is important. We've never faced anything like this to my knowledge. Most of the diseases that can be transmitted, at least through air contact or in just proximity, usually you have symptoms and you can tell, oh, that person's got the flu, I better stay away from them. That person's, it isn't the case here. So it's just a reminder that this isn't the flu. This isn't your everyday kind of thing. We have kept it down. I think we're at 80,000 deaths in the United States in the past 10 weeks. 80,000 deaths. That's more deaths from combat and disease in the 10 years of the Vietnam War. In 10 weeks. More than the Revolutionary War that gave us our country. We've lost more people in 10 weeks. This is serious. We have been doing well in York. We do deserve to find that balance between reopening our businesses in a safe way, because I completely respect the economic impacts that this disease and these closures are having on everyone, including the city of York. We're down millions of dollars in revenue that we're going to have to figure out down the road. But the fact is that we are doing much better than almost the rest of the state because of how aggressive we have been, because of how ahead of the game our Bureau of Health and Dr. Howie have been, and I thank you and thank all the Bureau of Health members, because of us taking it seriously. So please continue to take this seriously. I will continue to advocate for the movement into the yellow phase. I have also advocated to the governor's office that we get some kind of definitive plan on opening those businesses that do not open until the green phase. We need to have a plan. And I'm addressing the governor at this point. We need to have a plan. We can't just sit here with empty barber shops and empty restaurants and empty nail salons and say we're going to wait forever. That can't happen. We need to have a plan that has metrics that tells us how we're going to open our businesses back up again. And I'm advocating for that. I continue to advocate for that. And I think that we are following all the laws, but aggressively speaking for the people of York City and York County. And I'm comfortable with that. And with that, I hope on Friday, maybe we'll see each other a little bit more around the city of York. But please, even when we go to a yellow phase, it is imperative that we continue social distancing, we continue to wear masks, and we don't treat this like the threat is over. This threat will be continuing for quite a while, and it'll reconstitute, for lack of a better term, in the fall. If this does slow up for a while, we have to be constantly vigilant. And things are going to be different for a little while here. But I am advocating for the health of the community and for the economy of the community. And thank everybody for their support. So, see you around the city. Be safe.